If the gallbladder is necrotic, is recovery worse? The darling who asked this question is interesting. And you know what necrosis is? Remember that infected wound that seems spoiled? It's basically that. And the answer is, it depends. Depends isn't an answer. So stay there and I'm going to explain human. I'm Dr. Marcio Fernandes, general surgeon and head and neck surgeon, and this channel is dedicated to the world of surgery and against rambling. Rambling is straightforward, and since this is the place where you learn, let me explain how it works. Inside our bellies, folks, things don't just hang loose. Inside our bellies, all the organs are attached with ligaments. And inside our bellies, as I've explained in other videos, there is a cavity. This cavity is where the organs are, but it's a clean cavity. No liquids, no contamination, no infection. So the guts are inside, but the guts are enclosed. The contents of the gut are going through there and will come out the anus. In other words, you eat through your mouth and it exits through your anus. And the part of our abdominal cavity always stays clean. Just like the gallbladder that's in the liver. It's in the liver, but it's sealed off. The little balloon, the bile is in it and stays inside the gallbladder. Same as the secretion from the intestine, like the secretion of bile. If it falls into our abdomen, into our abdominal cavity, it will cause inflammation. It will cause an extremely dangerous, serious inflammation, which could even lead to the patient dying from sepsis, from the generalized infection. After we understand this, we're going now to the aspect of necrosis of the gallbladder. If the patient has gallstones and he has symptoms of recurring pain, this patient needs to have surgery. Why? To avoid complications like the one we're about to discuss. If this patient starts to have an infection, inflammation, pain, that is because the stone is blocking the gallbladder's exit. This gallbladder suffers, inflames again, until the point where it loses the ability to maintain the integrity of the gallbladder wall. That is, the tissue that was once normal from the blistered gallbladder. It underwent so much inflammation and such a severe infection that it spoiled, it decayed, and that's what we call necrosis of the blistered vesicle. But the blistered vesicle may be necrotic, yet it remains sealed. It still has a closed wall with bile inside, but the gallbladder can also necrotize and rupture and cause the bile that was inside the gallbladder and the bile produced in the liver to spill into the abdomen, and thus initiate an extremely serious inflammatory and infectious process. Extremely severe inflammatory and infectious process. That's when we talk about the patient experiencing pain, having a pain crisis, and some misguided advice telling the patient not to have surgery, but to keep cleaning. Imagine the seriousness of that. And then, once you understand what necrosis and the belly compartment are, comes our friend's question. If there's necrosis, is recovery worse? When I say it depends, it's because it depends on if the patient had been having many pain crises, infection, and he goes in and out to perform surgery, and at the time of surgery, despite the necrosis, the gallbladder stays intact. It did not burst. This patient's surgery most of the time will be a surgery with a bit more technical difficulty due to the inflammatory process, but there will be a calm, normal recovery, only with the use of antibiotics added to their recovery. Now, if this patient had gallbladder necrosis and the gallbladder ruptured and he was in a more serious state of infection and underwent surgery, so for sure his recovery will be much more difficult. First, because the fact that the gallbladder burst and the bile that was inside drained into his belly will generate an inflammatory process throughout his belly and not just in the gallbladder where it was previously. So this infection all over his belly increases his recovery time, as well as the type of antibiotic we're going to use and the length of stay that patient needs to stay in the hospital. This doesn't necessarily mean that that surgery he did by video will change, even with this type of complication. The surgery is still by video. However, this type of complication also increases the likelihood of conversion of the surgery. That is, a surgery that was by video turns into an open surgery, which also increases the recovery time and worsens the recovery of that patient. So when we talk about recovery, if we're talking about a patient who has necrosis of the gallbladder wall, but it's disseminated necrosis, that the gallbladder burst, that had a more generalized infection, of course, the recovery is going to be much worse. And if we are talking about a patient who, despite having necrosis of the gallbladder, it's a punctual, localized necrosis, without the gallbladder having ruptured and without having a great clinical repercussion of this patient, his recovery will be much smoother and very similar to that of a common gallbladder surgery. Did you guys get it? If you understood and liked it, consider the possibility of subscribing to our channel completely free. You get daily videos. Don't forget Instagram. Open the question box right there. A personal hug, then I'll show up there to bother you.